and welcome to today's session. Our theme today is Yes, I Can. Yes, I can detect cancer early. Yes, I can survive cancer. As you all know, women today are multifaceted. We all take care of our families along with our aspirations. Yet, health does take a toll on us at times. For this International Women's Day, we bring you in depth discussions with some of the best oncologists, pathologists, geneticists, genetic counselors, and survivors to debunk some of the myths regarding human cancers and its management. Today we have with us Dr. Rakesh Chopra. He's pioneer in medical oncology in North India. And we thank you, Dr. Chopra, for joining us for this event. And I'm glad you're doing it even when you are out of India. So thank you so much.
Thank you.
We have we are debunking some of the myths on early cancer detection. So my first question to you is, we often hear about early cancer detection and why women should screen themselves so that cancer is detected early. But what are the exact benefits if cancer is detected early in a woman?
See, thank you, Payal, for having me. 85% of the breast cancers are sporadic and 15% are hereditary or are passed down in generations. So when we say early detection, we mean in two categories. That is those who are at a high risk, where there's family history, and those which are at average risk in the community. Now, when we detect cancer early, it means that you are teaching women to do self-breast examination. That means that if they detect anything unusual, either in the form of a physical appearance of the breast, or if they find that there is on palpation, we teach women how to do a self-breast examination day 7 of the completion of the period. And we see that if they notice anything lumpy or in any way abnormal from their normal appearances, then they can go for a physician's examination and then further checking for that. So basically, it is any abnormality seen on a self-breast examination. Now, in the high-risk group, so normally after the age of 40, we start advising women to do a regular checkup. That means one physician checkup once in 3 years, and to do a mammography. Now, earlier on, it was over 50. Now it is after 40, 45, depending on the population. Now, in India, for example, we have younger population getting breast cancer. So one has to be guarded for that. For the people who are at a high risk, where there is a hereditary component, that means they have the BRCA, the BRCA1 and 2 gene positive in their in the mother or in the family, then they have to start doing the screening earlier. Now, the question of why you detect early is because you do staging of this. You have the TNM classification, the tumor size, the nodal involvement, the lymph nodal involvement in the axilla, and the metastatic disease. So by doing TNM classification, if it is an early disease, you want to detect the disease early so that you can tackle it with minimal treatment and best outcomes. Now, sometimes even smaller disease can increase in its growth and spread to other areas, but by and large, you are able to control it. Second thing is this, that we do other testings on this breast tissue. That means that you do molecular markers, etc., to direct your therapy. Now, when you do early detection, the chances of you getting a better outcome, which is in our language, say a 5-year survival or more, is much better if it's a T1 disease, or even that means that it is palpable less than 2.5 centimeters. 2.4 to 0 centimeters is T1 disease. And if it does not involve the lymph nodes, or it has not spread to the lymph nodes or anywhere else in the body, the chances are that you will be able to control the disease better. But of course, we depend on biology to a large extent. That means the behavior of the tumor after it has been detected, as to whether, depending on that, we direct our therapy accordingly. The second question is about the whether all lumps are cancers. No, that is a myth. All lumps of the breast are not cancerous. Many young women have dense breasts, and they have what is called as a benign breast condition, which are called as fibroadenosis. So because there is so much of a hype for women who detect a lump, so what they think is that every lump is a cancer, and they immediately start getting surgeries done and things like that. But there are certain telltale signs of a benign breast disease, and on mammography, on clinical examination, by taking the history and so on and so forth. So you have to go to a doctor who is experienced in breast diseases, whether they are benign or malignant, and then get treated accordingly. So it is not essential that all breast lumps are malignant. Especially younger women, there's less chances of it because they have dense breasts, and this accumulation of fibrotic material and fat is called fibroadenosis, and these are quite common in these.
Thank you, sir. This was such beautifully explained, specifically the exact benefits and technically understanding why early detection would help. Lastly, I would just like to ask you if there is any message for us women on this International Women's Day that you'd like to give.
Yes. All women deserve to have the best health care, just like all men. Unfortunately, earlier on, women were taking a background. For example, suppose a lady was detected with a breast lump or a breast malignancy, she would get her surgery done, say, when the children's school was closed, or because she does multitasking. She has to look after the family, she has to look after the children, the husband, and the in-laws. So it becomes difficult sometimes, and they delay treatments. So this thing is that please do not delay anything which you think is unusual, so that you can get the rightful treatment. And also, I think that all women must get the best treatments for their condition, because if they are there in the family, they can take care of the rest of the family. So the children, the husband, all depend on them. So I think that they deserve the best as far as management is concerned.
Jaan hai to jahan hai, I guess, sir. I've heard this often during my career as well. So thank you so much for sharing all these pearls of wisdom, and thanks once again for joining us on this call.
My pleasure.